India has recorded 6,594 new coronavirus cases in the last 24 hours. The daily positivity rate stands at 2.05%, while the weekly positivity rate stands at 2.32%. The national recovery rate was 98.67%. The cumulative COVID vaccine doses administered across India has exceeded 195 crore. Maharashtra recorded 2,956, approx 3,000 new cases of COVID, while the active tally crossed 18,000 mark. Meanwhile, Delhi reported around 1,200 new COVID cases. That, viewers, is an 82% jump from yesterday's 614 cases. Gujarat reported 165 new COVID cases. Tamil Nadu lodged 332 new COVID cases. I'm being joined by a panel of experts, also being joined by my colleagues spread across, of course, the length and breadth of our country, who will help us, first of all, understand, put these numbers in perspective, and the doctors who are joining us on the panel will help us understand really the futuristic view as to what we need to do to ensure that we remain safe as COVID cases are rising. Dr. Ishwar Gilada joining us, Dr. Anil Arora also live with us. Thank you both for joining us on NewsX. Sujata Dwivedi joining us from Mumbai, Abhijit from Gujarat. Before I go to the learned doctors, I'm going to first go to my colleague Sujata. Sujata, far as Mumbai is concerned, we are seeing a phenomenal rise in the number of COVID cases. Help us understand, first of all, the number of cases reported in the last 24 hours and the active case tally in the state.
Yes. So currently, since mid-May, we see that there has been almost 1,000% rise in the daily COVID cases that are being recorded. For the 7th consecutive day, a 4-digit figure has been recorded of the active cases in Mumbai right now. And yesterday in Mumbai, there were around 17,000 plus fresh COVID cases that were recorded, along with 2 fatalities. And currently, the active cases stand at the 5-digit figure of around 11,000. So this becomes very crucial for the government at this point to curb the spread of the virus by making the mask mandatory. Also, the deadly BA.4 and BA.5 transmissive Omicron variant, 4 cases of these variants were recorded in Mumbai, out of which 2 cases were of girls who were only 11 years of age. And now that the schools have reopened in Maharashtra and Mumbai, so it becomes crucial for the government to look into the situation, and also the government has been taking precautions for the same. Since the reopening of the schools, the government has made mandatory for the vaccinations as well as the booster doses for the teaching as well as the non-teaching staff, and also the vaccination camps have been set up in schools for the children who are above 12 years of age, and the government has been trying that this shouldn't result into becoming a super spreader event of the virus in Mumbai.
Right, stay with us. We also are being joined by my colleague from Gujarat as well, because the number of cases are rising everywhere. Abhijit Bhatt is joining us live from Gujarat. Abhijit, over to you. Where do the numbers as far as COVID cases in Gujarat is concerned, where do they stand, and what is it that you're hearing from the administration?
बिल्कुल मैं बता दूं, जिस तरह से गुजरात में पिछले 24 घंटों में नजर डाले तो 165 केस दर्ज किए गए कोरोना के, और जिस तरह से पिछले 105 दिन के बाद इतने केसेस आए हैं, तो ये बहुत चिंता का विषय है, क्योंकि ये साल जो है, साल के आखिर में गुजरात में चुनाव होने और प्रधानमंत्री नरेंद्र मोदी का भी दौरा आए दिन होता रहता है, और 18 तारीख को भी वापस गुजरात के दौरे पे आ रहे हैं। तो इसको चलते प्रशासन काफी चिंतित है, और राज्य सरकार ने भी जो सतर्कता दिखानी है वो सतर्कता दिखाना शुरू कर दिया। और खासतौर पे जिस तरह से समर वेकेशन के बाद स्कूल स्टार्ट हो रही है और स्कूल्स में भी बच्चे जा रहे हो, और काफी सारे बच्चों ने अभी तक पहला या दूसरा डोज जो वैक्सीन का है वो लिखी, सरकार ने कई जगहों पे कई बड़े शहरों में इसका आयोजन किया हुआ है वैक्सीनेशन का। और जिस तरह से सूरत की बात करूँ तो सूरत में कल से जो स्कूल स्टार्ट हुए, तो 4 जोन में 16 स्कूल में 792 स्टूडेंट्स को वैक्सीन दिया गया। तो इस तरह से सरकार भी सतर्कता से आगे बढ़ रही है। सरकार ने भी सबको अलर्ट रहने के लिए बुलाया, खास करके सरकारी अस्पताल है और जो निजी अस्पताल है वहाँ पर भी अलर्ट रहने को बुलाया, क्योंकि जिस तरह से दूसरी और तीसरी लहर में हम लोगों ने देखा था कि बहुत ही खराब स्थिति हुई थी, तो उसको चलते ऐसी स्थिति का निर्माण ना हो, उसको चलते हुए सरकार ने इस बार से प्रिकॉशनरी एक्शंस लेना शुरू कर दिया है। जी
Well, absolutely. So the administration this time around has started taking precautions, of course, asking people to wear masks, to maintain social distancing. But are we doing it? Or do we need to do it? Dr. Anil Arora, and also joining us is Dr. Ishwar Gilada to help us understand more on the same. First of all, over to you, Dr. Arora. Help us understand the significance of wearing masks, of washing our hands time and again, of maintaining social distancing, because that is something, the basics, we seem to have forgotten. Yes, I understand the sentiment prevailing far as the common man is concerned. It's been too long. Nobody wants to go back to lockdowns. We all want to live our lives. But these basic precautions, sir, would you say till date extremely important and absolutely necessary?
Thank you, Meenakshi, for having me on your show. I think you have a very pertinent question. If you look at the trajectory of the virus over the last 2 years, every time we think that the virus has gone away, it surfaces with a new ugly head. I do not know whether we'll ever learn the lesson of having universal precautions, which are far more important, far more effective in giving you a almost complete protection in the presence of an adequate vaccination in the background. But problem is, every time the wave passes off, we think it was just a passing wave. We are the ones which are not going to be affected, and we go and make merry. If you look at the tourism, the routine activities, the leisure trip, everything is gone even beyond the pre-endemic statistics. So this is what has culminated in recurrence of infection for three reasons. One is we have been really slackening in our approach of vaccinating everybody and anybody for the time being. And we also know that the virus is perfidious and it has a tendency to mutate. Since the virus is mutating and the vaccination is not enough and we have been relaxing, these are three major reasons that virus is coming back with a bang again. Again, if we stick to the basics of wearing mask, even though it is uncomfortable, it is certainly going to protect us. We still know very clearly that the newer variants of the COVID-19 infection, that is BA4 and 5, are not fatal and they do not cause severe disease requiring ICU care. But certainly it leads to morbidity, absenteeism from the work, disruption in the economic activity and isolation. To prevent all that, what you need is a basic precaution of wearing mask. Unless WHO or the government of India declares that we are totally free from the pandemic of COVID-19, I think the least we can do is continue to have the good habit of wearing mask and having a good hand hygiene technique.
Well, absolutely. Wearing mask, having a decent hand hygiene technique, these are basics which we need to follow. But Dr. Gilada, what will you say today? Booster shots, sir, are available. Why is it that there is so much reluctance to take the booster shots? Most of us got vaccinated at the earliest. But when it comes to boosters, many are planning it according to their trips. Many are delaying it, thinking that the Omicron version is much milder. What would be your method, sir, in this scenario?
I will address both the points, but I would like to first tell that in the changing scenario, the current variant is not potent enough to give you morbidity and mortality. If you look at the number of cases, out of those number of cases, only 1 to 2% land up in hospital, and out of which, if you calculate case fatality rate, which is 0.1%, and the case fatality rate in flu is also 0.1%. All along for 2.5 years, we wanted that COVID to become so mild that it should become like a flu. Now it has become like a flu. We are not bothered about flu, but we are bothered about COVID. Somehow our psyche is tuned to the number of cases, not to the number of hospitalization, not to the number of oxygen demand, not to the number of deaths. When those trajectories are very, very low, I think we should not give much of a credence to this kind of new rise in cases. They are bound to play up and down. There are people who are projecting something like on 21st of June, there is going to be a fourth wave. They have even a date like a horoscope. That horoscope of India says 21st of June will be fourth wave. Now coming to your question about booster. See, our psyche about taking a vaccine is linked to number of deaths. Or as soon as we see people in mask, or as soon as we see headline, people start going for vaccination. Currently, our vaccination rate is around 15 lakh per day. India's capacity is 2.5 crore a day. So not even 6% of our capacity we are exploiting. And we have close to 15 crore vaccine lying. If with the 15 lakh of per day capacity, we will require 100 days to complete those 15 crore doses. and the doses will expire by July end. So we should look at the number one, can the gap between the second and the third dose be reduced from 9 months to 6 months? Number two, can 60 below people be given also free vaccine rather than only paid vaccine? Because currently free channel is closed for them. Number three, can we speed up the vaccination of children? And currently in India, we have 2 or 3 different agencies which are at cross purposes. DCGI, Drug Control General of India, has given permission to Corbavax for booster mix and match. It is not implemented. DCGI has given permission for a lot of pediatric vaccination, lot of which are not yet started.
Yeah.
So I think this Netagi committee is sitting on a lot of recommendation, and they have their own views and views.
Yes.
I think we should
Absolutely so. Absolutely, sir. And those are some pertinent points which you raise as far as pediatric vaccinations are concerned, even for those who are, 2 years and above. It started in many countries. Why not in India? Many recommendations, of course, which we hope will be implemented at the earliest. Stay with us, both of you. We have another big news coming in from the world of health.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.